So I think admissions have slowed down a bit now, and I can probably start by welcoming everyone. Um, so nice to see so many here, and welcome to our speakers as well. So on behalf of the Neurodiversity Collective, thank you so much for joining us for this important conversation on neurodiversity and later life. I'm Charlotte Willer. I'm the founder and CEO of the Institute of Neurodiversity. For far too long, our discussions around neurodiversity have focused almost exclusively on childhood sort of education and employment, but neurodistinct people do not just disappear when they become adults. And we certainly do not disappear when we grow older, as I'm a living proof of at 62 and late diagnosed autistic and ADHD when I was 50. Yet many neurodivergent people in later life have lived entire lives unseen, misunderstood, misdiagnosed, or unsupported. Some were told they were difficult, some were institutionalized, some simply learned to survive silently. A key reason for me to get diagnosed when the prospects of potentially living with dementia, not knowing, and carers not understanding why I would potentially behave differently. Today and tomorrow are about changing that narrative. This conference is not only about challenges, it's also about identity, resilience, creativity, adaptation, wisdom, and humanity. It's about recognizing that aging is not the end of relevance or contribution. I certainly don't hope so. It's another stage of life, one that deserves dignity, understanding, and inclusion. We will explore ageism, gendered experiences, menopause, late diagnosis, new research horizons, and the lived realities of neurodivergent adults in later life around the world. Importantly, this is also about systems. Many of our health systems, workplaces, care systems, and social structures were never designed with neurominority people in mind. And when aging intersects with those systems, exclusion can deepen. But exclusion is not inevitable. It's designed, which means we can also redesign it. At ION, we believe the future must include all minds across all ages, cultures, and life stages. So I hope these 2 days will spark not only discussion, but action. Better research, better policy, better healthcare, better representation, and ultimately a more human understanding of aging itself. So thank you again for being here and for helping move this conversation forward globally. I will now pass over to Susan McKay as the moderator for the first session.
Many thanks, Charlotte, and welcome everyone. Our first session is going to focus on what now many people describe as the last socially acceptable prejudice, ageism. And when ageism, as many of us know, intersects with neurodivergence, that these effects can become profound. And too often, older adults are overlooked, misunderstood, excluded, or reduced to stereotypes. So in this session, we've got two outstanding speakers who are going to help us challenge those assumptions entirely. And we'd really like this to be an interactive session, so we will be opening for Q&A. So we would love you to pop your questions in the chat, and I will try and field them to our speakers. But firstly, it's my great pleasure to welcome our first speaker, Professor Sandra Thom-Jones. Sandra is an autistic author, academic, advocate, and consultant whose work is helping reshape how we understand autism across education, employment, and society. And Sandra spent more than 2 decades in university leadership and research, including as Pro-Vice Chancellor for Research Impact at the Australian Catholic University. She's the author of Growing into Autism and the forthcoming books Autistics in Academia and Autistics at Work. And through both lived experience and research, Sandra's challenging deficit-based thinking and asking what becomes possible when autistic people are fully understood, valued, and included across every stage of life. So please join me in welcoming Professor Sandra Thom-Jones. Many thanks.
Thank you. I will just get this to go. All right. Now, I'm going to just start by saying, although I do all those positive things and I'm really focused on those positive things, today I've been asked to talk about the negative stuff. So I'm going to talk about autism and ageism, which I agree is very important. And I know that the next 2 days there's going to be lots of discussion about positive things and positive changes and where we can and are making great contributions in this space. And I'm just going to start with raising some of the issues and concerns around where these two things intersect. So I want to start with, I know we all know what autism is, so this is not I'm not giving you a talk on what autism is, but I just want to draw your attention to this. We all know these things, you know, autism is a lifelong neurodevelopmental condition. It's not linear, it's a spectrum. But I just want to really focus on this word here, because I think that's the thing that so often gets forgotten when we talk about autism. And that's really the focus of what I want to talk about today. I want to talk about a couple of problems that we have in this space and then sort of hint a little bit at the end at a solution. So my first problem is that we, and when I say we, I mean older autistic people, older neurodiverse people more generally, but I specifically speak about autistic people because that's the lived experience that I have and that I know and what I've been researching for 20 years. We're invisible. So I don't know if you've ever done this, but if you ever Google search autism, and you can do this by searching for words or you can searching by images, you'll find something really interesting. If you do a Google image search for autism, this is what it looks like. And this is what the community thinks it looks like. Autism is about children. Mostly it's about little white boys. And if you look at the media, you look at what people talk about, what people think about, what people understand, this is what they think when they think autism. But it's not just the media. It's not just Google. Unfortunately, it's also our governments. Now, this figure I'm going to show you here, this is an Australian figure, but I promise you that if you looked at it in any other country, it's going to be pretty much the same. This is our Australian Bureau of Statistics data on autism prevalence by age. So this is what the government puts out, and this is what, you know, media outlets and everyone else picks up. And there's a very clear message here, and it's actually the way that the Bureau reports it, which is autism prevalence is highest in that age range from, 5 to 19. Now, obviously, that's absolute nonsense when we're talking about a lifetime condition, but that's the way that it's described, that's the way that it's worded. And the simplest change they could make is to add one word to that title, because if instead of calling that autism prevalence by age, we called that autism diagnosis prevalence by age, we would have a much better understanding of what the picture here is. Because what this simply is the proportion of people in each of those age groups who have an autism diagnosis. And there's really good reasons why people at the upper end of this age range don't have a diagnosis. Most of us, we were at the age range when they were picking those things up. We didn't, autism wasn't a thing. Certainly in my generation, it wasn't something we even considered, particularly for girls, but it wasn't really something that was considered for boys. In Australia, also lots of other countries, autism diagnosis is incredibly expensive for adults. It's covered by government funding for children, but not for adults. But this is the message that gets out there. This is what prevalence looks like. This is what our government tells people. And it really contributes to that myth that this is a childhood condition. It's something we grow out of, or we're cured of, or it goes away, or it becomes less of a problem as we grow older. It doesn't change. And those of us who are autistic know that. In fact, for many of us, it actually gets worse. Not that our autism gets worse, but the world around us gets less tolerant and less understanding, because though being autistic is okay when you're a child, it's more of a problem when you're an adult because you don't look like the pictures on Google. And the world becomes harder, and you've spent your whole life masking, and it gets harder and harder to mask. The reality is the prevalence of autism looks more like that. It's a completely straight line, although to be honest, it looks more like that because there's so few of us that have actually got a diagnosis. And I think we really need to change that conversation. We need to be saying that to governments. This is not a table of autism prevalence. This is the table of autism diagnosis prevalence. So what does the data say? So this is from the Global Burden of Diseases, Injuries and Risk Factor Studies, which is a horrible, horrible study name if we're talking about the fact that they include autism diagnoses in it. But that aside, the reported number of autistic people aged over 70 years increased from 895,000 in 1990 to 2,479,000 in 20, sorry, I didn't say that very well, in 2021. That's 177% increase in that time period. Now remember, that's the reported number of autistic people aged 70 and over. It's projected that by 2040, this will more than double again to being 5,150.9 thousand worldwide. But that's just the ones with a diagnosis. Now, in their report, they say that the largest reason for that increase over time is just overall population growth, right? Because the proportion of autistic people grows as the proportion of people in the world grows. But the second biggest reason is the increase in age-specific prevalence. And again, it's not an increase in age-specific prevalence of autism. It's age-specific prevalence of autism diagnoses. As we're getting better at diagnosing autism in adults, and because more and more adults are being diagnosed because their children are diagnosed, and as we all know as adults who've gone through, certainly my generation and the generation before mine, you go through life thinking, I'm fundamentally broken, there's something wrong with me, I don't work the way the rest of the world works. And then you have children who are beautiful and perfect and just like you, and they get diagnosed as autistic, and you go, oh, maybe that's why I'm not like everyone else. And so many of us as adults are diagnosed because our children are diagnosed, and so many older adults are diagnosed because their grandchildren are diagnosed. So, when we talk about this age-specific prevalence increase, again, it's an increase in diagnosis, not an increase in incidence. But I know that a lot of you are in the UK, so what might it look like in the UK? This was a really great study recently where they compared patient records in GP practices and looked at the diagnosis rates in different age groups. So in 15 to 19-year-olds, it was 1 in 23 males and 1 in 75 females. But in 70-plus-year-olds, it was 1 in 3,000 males and 1 in 44,000 females. That's a huge lot of people who don't have a diagnosis. Because remember, we're talking about a flat line. You're born autistic, you die autistic. So the number of 70-plus-year-olds is the same as the number of 15 to 19-year-olds. So based on current estimated prevalence rates, they calculated that somewhere between 3 and 7% of autistic people aged 50 and over have a diagnosis. Think about that. That's 90 to 95% of autistic people over the age of 50 don't have a diagnosis. And all of those people, many of those people don't know they're autistic, but many of them do. They don't have a diagnosis. They don't have access to a diagnosis. The services aren't there. The services are not affordable. And not having that diagnosis for many people limits their access to a lot of services that they need. It also really increases the risk they're going to be misdiagnosed with something else. They're not going to receive appropriate supports, particularly as they get older and people start saying, oh, maybe it's depression, maybe it's anxiety, maybe it's dementia, maybe it's something else. This is a really scary problem for our older population. And as a person moving into that age group myself, I find it a very scary problem. So what does the research tell us about autism and aging? Now, the short answer to that is not very much at all. So some of you are probably familiar with a really good, thorough 2020 review that looked at research papers on older autistic adults. And they found in the entire body of literature since the beginning of time, 212 research papers that included older autistic adults, if you define older as people over 50. So this is not just papers that were specifically on older adults, this was studies that had some older adults in it that could be separated out from the other people. 212. But even within those 212, it mainly focused on cognition, brain, genetics, things scientists like to do to little parts of us. 9 articles on the support needs of autistic people over 50 and none on residential care. So this is the body of evidence that is available to practitioners to decide how to support older autistic people. Now, some wonderful people, the following diagrams were not produced by me, and I do have the citation at the bottom. Some wonderful, very clever people, cleverer than I am, mapped beautifully what that actually means in relation to the overall body of literature. So that 212, which is actually 174 articles specifically on older people, have a look at how that compares to other age groups. And this is from the Stewart paper, not something I did. But look at that. That to me is just amazing. So 34,000 between 1980 and 2021 on children, 6,000 on adolescents, 9,000 on adults in general, 174 on older adults. And in case you're thinking, well, it's getting much better over time, isn't it? Not really. Like that's the trajectory over time. So a massive increase in research on autism in children, a good increase in research on autistic adolescents, autistic adults more generally, but really not a lot moving along in terms of old age. And, you know, that's their term, not mine, because I don't think of myself as old. But, you know, we're just not doing the research. And that's really critical when we've got this growing population and we just don't know what's going on with that population. We don't know how to support that population. The little research that does exist, what does that actually tell us? It does tell us that up to 2/3 of older autistic people experience anxiety and or depression, and that's associated with poorer quality of life and with reduced participation in social activities, which is not surprising. It tells us that compared to their non-autistic counterparts, autistic adults over 50 have poorer physical health, more co-occurring conditions, and higher rates of psychiatric conditions. Now, I want to be clear here. This is not because there's something inherently wrong with autistic people. This is because the healthcare systems, the support systems that are around us don't work. If you look at the literature around autistic people of all ages and their access to healthcare and the support that they receive in healthcare, it's really not surprising that our physical health is far worse. And I don't think that's because as autistic people, we're fundamentally got, you know, poorer bodies. But when we reach out for healthcare, we can't get the support we need. We're not understood, we're not supported, we're not listened to, we're not provided with the care that we need. Not surprisingly then, the research tells us that older autistic people are often reluctant to disclose to healthcare providers that they're autistic due to the stigma and stereotypes that are associated both with autism and with aging. So what the research tells us is not very positive at all. It also, as I said, there's very, very little research on social aspects of what it's like to be an older autistic adult. It does tell us that there's an association between that lack of social support and all aspects of quality of life. It tells us that social connectedness decreases with age for everyone, autistic or not autistic, but loneliness increases with age for autistic people, and especially for autistic women. It tells us that there is a higher likelihood that older autistic adults will live in group or residential settings. Now, that's probably not surprising if you think about it in the context of autistic people are more likely to be socially isolated, not to have social support, to be alone. It's probably not surprising that we're more likely to end up in group or residential settings. Thinking about that, the fact that that review I mentioned earlier tells us there is no literature on how to support this large and growing cohort is really disturbing. The literature also tells us that current models of what aging well looks like may not be appropriate for older autistic people, because all this wonderful research on aging well is based on what aging well looks like for neurotypical people. And if you want a visualization of that, think about those ads that you see for aged care on telly. I see these ads for aged care, aged care homes you want to go and live in. And it's just, and it's got all these people sitting around and they're all chatting and they're laughing and they're playing board games and they're all having their dinner together in the dining hall. And I watch that and I think, that's supposed to make me want to go there? That makes me think, no, just let me die at home, please, even if I die 10 years earlier. Don't make me eat in a loud, crowded, bright dining room with those people and force me to socialize. So aging well for us can look quite different to aging well for neurotypical people. Um, this is a very recent study, and I don't have time to unpack it in the time that I've got because I want to get through all the things that I want to get through. But I think there's so much to unpack in this study. UK survey of older autistic and non-autistic adults found that we all retire at around the same age, but autistic adults are less likely to be working full-time at the point they retire. They have lower pre-retirement income and savings, less likely to have made plans for retirement, and more likely to have had our plans disrupted by health or financial or personal factors. All of these are systemic issues. Again, these are not fundamental flaws about autistic people. These go back to all the stuff that we know, not from the research with older autistic people because it doesn't exist, but the research with autistic people in general that tells us that workplaces are hostile for autistic people, that social and environmental and economic structures are hostile for autistic people. So we're going through our adulthood in an environment that makes it difficult for us to work, difficult for us to accrue income, difficult for us to actually put ourselves in a position where we'll be able to retire comfortably and safely. So it's probably not surprising that we get to retirement, and of course we work as long as everybody else because we don't have a choice because we haven't got any money. But then when we get to retirement, we're going to have so much less choice than our neurotypical peers, even though the choices that are available to us are going to be so much less appealing and our needs are going to be higher. All right, so this paper, which this is a wonderful, everyone here I'm sure reads Autism in Adulthood. There's a new roundtable discussion paper that's just come out where a wonderful group of people sat down at this brilliant roundtable about what are the gaps in autism and aging research. If you wanted to sum it up in one word, you could say everything, but they said a lot more than one word. And they made this wonderful list. I really recommend that you look at this paper because it does a really good job of outlining some of the many, many gaps. So I suggest people look at that and just get a sense of some of the different places. Go and get 150 PhD students and get them to start addressing some of these topics. There's so much that needs to be done. All right, so that was our first problem. Our first problem is we're invisible. Nobody knows about us. Nobody cares about us. But when we do pop our heads up above the parapet and they do see that there's older autistic people, we experience systemic discrimination. Firstly, there's the discrimination associated with aging. So people of all ages show bias against older adults, including older adults themselves. Now, this is something that's always fascinated me. There's some wonderful research that shows that those negative attitudes are so pervasive that when you ask older people, they have negative attitudes towards older people because they see that so much in the media, in public conversation. There's just this perception that being old is bad and it's negative and it's depressing. Those negative stereotypes impact all aspects of older adults' lives. And there's a lot of evidence that if you buy into those stereotypes, it's actually going to impact the way that you feel about yourself, the way that you feel about your life. Age bias impacts the way health professionals interact with older patients, including the way that they interpret symptoms and the treatments that they offer to people. And that's really quite sad. Internalized ageism impacts our physical and our mental health, our happiness, and our well-being. So there's a whole bundle of discrimination wrapped around just aging. Then there's all this discrimination that's wrapped around autism. Now, this is just from some research we did where we asked autistic adults questions about their lives. What's it like in your life as an autistic adult? 70% said they felt socially isolated. Over half said they had lost friends because of the way their friends had responded to them as autistic people. 43% said they sometimes felt unable to leave the house because they're worried about people behaving negatively towards them because they're autistic. I mean, if you're not an autistic person yourself listening to this, think about what that means. That 4 out of 10 autistic adults feel uncomfortable going out there in the community, in society, because people make them feel uncomfortable being themselves. We asked them, in the last 12 months, have any of these things happened to you? 42% said that they had been avoided or shunned by people because those people know they're autistic. 55% said they'd stopped themselves from having a close personal relationship because they're autistic and the way people respond to them. 92% felt they needed to conceal or hide their autistic traits from other people. Now, we all know, we've all read the evidence on how much of an impact masking has on people. The massive physical and emotional toll that has, the impact it has on our physical health, the impact it has on our mental well-being. And that's why I said earlier that autism doesn't magically go away when you get older. The impact gets greater. And that's a big part of that reason, because many of us have gone through a lifetime of masking, which comes with massive health consequences and mental health consequences. And, you get to 60, 70, 80 years old and your body and your brain is just worn out from doing that. But we still feel that when we go out there, if we want people to accept us and interact with us, we have to hide who we are 100% of the time when we're out there in the world. And that's not a world that we should have to exist in. All right, so we've got those two things together. We've got that age-related discrimination and stigma and autism-related stigma and discrimination, and older autistic people get hit with both of those at the same time. Our third problem is that we are at increased risk of violence and abuse. So again, this is Australian data, and apologies because I know most of you are not Australian, but again, I don't think this is going to be any different in any other country, sadly. According to the Australian Institute of Health and Welfare, 1 in 6 older people living in the community experience elder abuse. 1 in 6. Psychological abuse, neglect, financial abuse, physical abuse, sexual abuse. This includes predominantly, because these are people living in the community, this is predominantly abuse from family members, from spouses, from children, from siblings. The older population is incredibly vulnerable and really, really vulnerable to abuse and violence and mistreatment from people who are, whether it's family members or whether it's carers in aged care, people who are supposed to be there keeping us safe. Autistic people of all ages are far more likely than non-autistic people to experience bullying, physical violence, sexual assault, domestic violence, and intimate partner violence. And there's a massive, massive amount of evidence on this that we are just far, far more likely to experience all of these, in many, many aspects of our lives, but particularly in interpersonal relationships, particularly in domestic partnerships, that autistic people experience far more and embedded violence throughout their lives. And again, those things intercept. So the older you get, the more likely you are, the more vulnerable you are to violence and abuse. And autistic people are far more vulnerable to violence and abuse. So if you've got this older autistic people, you're talking about an incredibly vulnerable group of people, because you've got those two risk factors, and we know that older autistic people are particularly marginalized, particularly isolated and vulnerable you have this huge risk factor there. And this was another finding. This is from quite a small pilot. When I say small, if you look at the body of research that's out there about older autistic people, it's probably not that small in comparison. But 118 autistic adults aged over 55. And we asked them, just thinking about this stuff that we knew about the fact that, older people are really at risk of abuse and autistic people are really at risk of abuse. Just only half knew where to get help if they experience violence, abuse, or neglect. And less than half knew where to get help if they experience discrimination or exclusive practices. That makes me really scared as an autistic person and as an advocate for autistic people, that we're talking about one of the most vulnerable groups here, people who are vulnerable because they're aging, they're vulnerable because they're autistic, and the majority of them don't know where to get help. They don't know who to ask for support in these situations. And I think that's a really huge gap in service provision and something that we really need to do something about. So when you bring those three things together, we've got older autistic people are invisible in the research, in the data. We experience systemic discrimination and we're at increased risk of violence and abuse. So that ageism and autism together is an area that really it needs a lot of attention. So I'm not going to end on a negative, don't worry. I still have 5 minutes to talk, so there is a positive. So what am I doing to help? I'm doing some research in this space. This is my passion project. I'm doing this project, which I call the Autism and Aging Project. I'm not great at imaginative titles. Exploring the experiences of aging as an autistic person. So I've been working with a wonderful group of people. You can have a look on my website. We're still a little bit of recruitment going on. So if you've got people in that age group who are still interested in participating, and what we're doing is getting people's reflections on different aspects of aging as an autistic person, with the idea, I'm not seeing this so much as an academic project in terms of a piece of research. I want to publish lots of journal articles. This is really about providing really practical, useful information that we can feed into services, into healthcare, into government services, into what's actually working and not working for older autistic people, and what kind of supports do people need, what kind of practical resources are they looking for, what are the things they want doctors, government services to actually know about what's our life like right now, and what could you do to make it better, what could our families and our support services do to make it better. So these are my participants to date. So some people are writing quite detailed reflections. Other people are participating in a survey. So still really keen to get some more people in that older end of my age range. But, it's been really, really rewarding for me just, getting people's views on, what they're experiencing, what they're enjoying about aging. There are some real positives about getting older as an autistic person. Some things do get a lot better, which is really good. Some things do get harder. And so some of the things that we're talking about are, identity, friends and family, where do you get your sense of purpose from? Where do you feel included? Where do you feel excluded? Your interactions with healthcare. What does aging well look like for you? What do you think about when you look into the future? So I'm having fun with it, and I'm making lots of new friends. They all feel like my friends now because we've just shared some really deep stuff. But what can you do to help all of the people who are here and all of the people that you have contact with? We need comprehensive education on autism in late adulthood for those who are providing services to aging people. So whether that's in healthcare or social services or government or residential care, wherever it is, we need that. They need to understand what autism looks like in older adults, that it's there, that it exists, and that it impacts every aspect of our life and our well-being and the way that we want to live in order to be happy and thrive. We need to open up conversations about autism with our aging population, and we need to provide services and information and supports in formats and places that are accessible to older autistic people. So when I think about things like all of those people who tell me, I don't know where to go for support. And, there's my half of the people who said, I don't know where to go if I'm being abused. But even in my autism and aging project, the number of people who are saying to me, I don't know how to get the kind of healthcare that I need. I don't know how to get I don't even know how to get aged care funding. I don't know how to get, basic services because I have to go on a website and I don't understand the information on the website. Or I can only access it by making a phone call and phone calls don't work for me. We don't have information in these spaces that's written in ways that make sense to autistic people. We don't have autism friendly services for older people because governments and agencies look at it and they say, oh, we've got all these autistic children, all these autistic people aged 5 to 19, we better produce materials for them. Oh, look at the data, it says there's no old autistic people, we don't have to worry about those. And it really disturbs me when I talk to people working in the aged care sector and they say, oh yeah, we don't really do anything in the neurodiversity space because we don't have many of those people in. And I'm like, yes, you do. You don't know it, but you do. You've got just as many there as you've got in primary school, right? So we really need to have those conversations and we really need to make those services and information and supports available. And I'm sure if they were there, if there were signs on the wall in the doctor's surgery, in the geriatrician's office, in the aged care service and everywhere else, all those older autistic people would probably be putting their hands up and saying, yeah, I'm here, I exist, because they would feel a lot safer to do that if they actually felt this is the place where people are going to listen and accept and make me feel welcome and not make me feel like, gosh, you're an old person and an autistic old person, we don't want you here, because that's the way we feel at the moment. And I think there's so much we could do to make people feel welcome and included and provide really supportive environments where autistic people can age in a way that's positive and enjoyable and can enjoy the rest of their lives. So that's what I wanted to say. And this is my contact stuff and all the rest of it. So thanks for listening.
Thank you, Sandra. And if I was overly positive introducing you, I can't listen to you and not be inspired by your energy and your passion and the hope that's coming in the work that you've been doing and continue to do. So I just want to invite people, please pop your questions in the chat. I'll very happily pose them to Sandra for you. I just to say there were obviously quite a few strong reactions in the chat as you were speaking, seeing the figures, the data. It's powerful, it's compelling, and I know that a lot of people on this in this part of this conference will be working to tackling your first problem of invisibility, because that is a very compelling set of data. As I say, I've heard you, I went and had a wee look online and you speak with great power. The data from a communication perspective, certainly that first problem of being invisible, we really need to start the movement. So thank you for that. There were some comments in the chat about was the conference going to be about ADHD, only on autism rather than ADHD. Certainly there will be discussion of ADHD too. I just wanted to ask you, Sandra, whether that had come up in reflections that you've been collecting as well. That's a different.
Yeah, I would say so. Probably with my participants. So I'm very specific in terms of like when I do research or when I present, I'm always very clear that I talk about autism because I'm an autistic person and obviously I'm a researcher by trade, but to me, lived experience tops everything in terms of, so I talk about autism because I'm an autistic person and I don't speak on behalf of people with ADHD because I don't have ADHD. So I don't know what that feels like. I can read about it, but then so can you. I can do research about it, but so can anyone else. I'm very clear that I speak about autism. I know a lot about ADHD and I can answer some questions, but I don't speak to that voice. In my study, with my older people, I would say probably about half of them are also ADHD, and that will be reflected in what I report. But yeah, that's why. And yes, as you said, I hope I haven't given anyone the wrong impression about what the conference is about. It's just I talk about what I know. So yeah.
Fantastic, thank you. There's a question here about whether your research is open to people outside of Australia.
Oh, absolutely. Yes.
Fantastic. So that is very much getting, I heard you call for more people to get involved. It sounds like you're going to have a lot of interested people. There were various comments in the chat about, I mean, many people are very actively involved. And there were some comments about organizing networks and community. What have you found with the value of that? Are you finding any best practices, any tips for sharing?
In terms of setting up networks for
Yeah.
older people, I think we need it. I'm surprised that it doesn't exist more. I've looked in a lot of spaces where I thought it would exist, and it doesn't. I think probably because although there are lots of us in older age groups, we're still very much in the minority. In terms of people who are identified as and know they're autistic and are open about it. So there are so many peer support groups for children. There are so many peer support groups for adolescents and young adults. There are some great things online. There are some, wonderful Facebook groups and, other social media groups that are very specifically for older autistic people. And, I joined lots of those because, I find those really helpful. And they often have sort of, okay, we're all having a tea and a chat or whatever, and people can catch up. I think that's really good. But in terms of physical spaces, it might be very different in the UK. Obviously, I'm in Australia, so I can't speak to the UK, but I know in Australia I haven't found any physical groups, and I think it would be great if there was more of that because given that we're talking about people, I mean, obviously for many of us online is great, but if we're talking about people who are often socially isolated and looking for opportunities to interact with other people, it would be lovely if governments could put some funding into that. I see so much money, and I'm not saying don't put money into supporting autistic children because obviously that's wonderful too. But I do see a lot of money going into, funding organisations that provide peer support programs and social activities and things for autistic children and adolescents. And I just don't see those resources going into older people. And I think if we look at what the value of that would be the benefit for the older community, the benefit for society in general. Uh, why government isn't putting money aside for that, I don't understand. I think that would be huge. But at the moment, I would say online, yeah, there are some good groups that people can, I would start with Facebook and just search things like older autistic adults or older autistic women or whatever it is you're looking for, and you can usually find them.
Oh, fantastic. And I think obviously, I hope the organizers of the conference are really thinking about how, such an important
Mm,
topic,
mm,
how can we use even this gathering of it seems from the chat, very resourceful people
mm,
to have a really strong follow on.
mm.
There's a very interesting comment made in the chat saying, pointing out that academia has to be one of the largest employers of autistic people. And yet some of them are conforming to very neurotypical uh, models in terms of, we've all heard of stories of very talented, skilled autistic academic staff. From your work on your book in academia, what insights do you have about the aging neurodivergent population who have been in academia? What do we need to do there?
Sorry to be depressing again, but yes, I would agree that academia is a huge employer of autistic people, which it logically would be. I mean, we're the ideal employees. If you look at what you're talking about a group of people who often have a very specific interest. They're very focused. We're hard workers. We bring all these strengths that are very relevant. Many of us love to share our knowledge. We make great teachers. We make great researchers. My experience with my research, and this is the focus of my book, Autistics in Academia. Like I said, I'm really creative with titles. Um, is is that, so many of us go into academia with all of these great skills, with all of this passion, and then get very badly damaged by systems in academia that are very bound around structures where they don't bend to neurodivergent ways of working, ways of existing in the world, but also where you're not necessarily rewarded for working hard and having knowledge, but you're rewarded for social skills and networking and politicking and a whole range of other things like that. And it was really sad for me seeing how many of my participants in that study were on their way out of academia. We're talking about, I either left during the study or we're talking about leaving or were staying, but it was hard. I mean, some of them did succeed. Some of them found really good supportive environments where the university was really willing to make it comfortable for them, and which often doesn't take a lot. It's really about attitude change. They don't have to like rebuild the university. They just have to actually be a little bit more welcoming. But I would say they were in the minority that, actually found those environments. Academia has to change so much. And it's academia that's losing out because they're losing such really, really good quality employees because they say, this is the way we work and, we want you to fit into this box.
Absolutely. And I think, this is very much a situation for older adults, particularly with the transition of the digital transition, the AI transition, that many adults are now finding, neurodivergent adults are finding themselves out of work kind of around their late 40s, 50s. So we do need it. But thank you. We will shortly be going to another speaker, but I really want to ask you if you have an ask of us before we move on. We heard your, what can we do with your data to amplify it? What can we do to tackle the invisibility? But you also spoke about some very serious issues around discrimination and stigma and psychological abuse and injury, but also physical risks as well. So what are you calling for us, having listened to you, to do for your insights? How can we help?
I would say raising awareness of those risks in the people who need to hear it. So, if any opportunity you have to interact with people in healthcare, in government, in any kind of other agency, just to raise their awareness of the things that they could do to support the older autistic population. If you see the way that they're offering a service or not offering a service, or a little tweak they could make to make it a little bit more inclusive. Give them a book to read, give them some resources about autism, make some suggestions to them about how they could actually make their services more inclusive, more welcome. Just, raise their awareness that older autistic adults exist. If you're talking to your doctor or someone and they say something about, oh, all these autistic children, or, just sort of, any little opportunity like that, just to raise their awareness that, autistic people are going to still be autistic when they're 90. And what could you do? I think the more we can have those conversations with all of those people who need to be constantly reminded that we exist, that we need support, and that we are vulnerable, then I think that's what's really important, just to keep those conversations going with the people who need to be changing.
Thank you so much. Thank you. You're very inspiring, and I know that we'll carry your inspiration and call to action throughout this.
Thank you. And sorry, I'm not staying for the panel later. It's midnight here, so I'm going to bed.
We'll let you go to bed. So thank you very much, Sandra. And that was a fantastic start to the conference. And so we're going to very much carry on the same inspiring energy. We're going to turn to Dr. Sabina Brennan, who is going to continue the conversation through the lens of neuroscience, brain health, and human resilience, which obviously is very much needed in this space. So you are a neuroscientist, a psychologist, a best-selling author, and one of Ireland's most engaging voices on brain health and well-being. You have directed a dementia research program at Trinity College Dublin, and you're widely known for translating neuroscience into practical, accessible, and really engaging insights. And that's wonderful for helping people understand their brains and themselves better. You're the author of 4 best-selling books, including 100 Days to a Younger Brain, Beating Brain Fog, The Neuroscience of Manifesting, and your latest work, Still Me, Exploring Dementia and Caregiving. So throughout your work, you combine science, compassion, and optimism in ways that really resonate with audiences around the world. So we're delighted you're joining us today. Please welcome Dr. Sabina Brennan.
Thank you so much, and thank you for inviting me to speak here today. My talk, as you can see from my slides here, is really focusing on aging, attitude, ageism, and action. I became a psychologist and a neuroscientist out of a fascination with the human brain and with behavior. My particular area of expertise, as you've just mentioned, is brain health, and that's relevant to anybody who has a brain, irrespective of what kind of way that brain works. And I'm also really interested in the factors that influence brain health and how we can keep our brains healthy as we age. And I can't underline that enough, the importance of brain health for everybody. I'm putting my hands up. I'm not an expert in neurodiversity. However, I have done a lot of work with neurological conditions, multiple sclerosis. I have migraine myself, and all the impact that they have. I mean, to be perfectly honest, when I hear all the, the issues associated with neurodiversity and aging, and they're echoed across all of the groups, that's the big issue, really. And so sometimes maybe there's a way people can come together as groups and say, hold on, we are diverse, we have different needs, we have different needs, we have different needs. And maybe there might be more strength in greater numbers. What I want to say is aging is a concept that we're all familiar with, but what do we really mean by aging? Attitude matters. What you think, what you believe, influence how you experience your life and how your brain performs and how it ages. Our attitudes and the attitude of others can feed into ageism, and that can really impact negatively on our health and our well-being. And to address that, I think we really, really do need to take action. So I'll briefly touch on some ways we can do that towards the end of the talk. I'm always really conscious of time because I'm so passionate about what I talk about that I kind of rabbit on. And my dad always said I could talk the hind legs off a donkey. So I'm trying to keep my eye on the time. Anyway, look, we're all really familiar with the outward signs of aging: graying hair, wrinkled skin, and many of us spend much of our time and our money trying to hide these outward signs. And that's not surprising because anti-aging products and messaging are ubiquitous and they're difficult to ignore. And aside from these outward signs, what do we really mean by aging? Well, in Western society particularly, we're obsessed with counting the number of years since birth. But if aging was just about chronological age, then we would all age at the same rate, and we don't. So that's not the case. Chronological age is just the years since you were born, and it's not the same as biological age or brain age, actually. It does, of course, play a role because things do change with the number of years since birth, but it's not the whole picture. And I think a really kind of positive way to view this is that our choices, our life exposures, and multiple other factors influence how we age. And I will talk later about, yes, some things that we've done in the past may not have been the best for how we age, but it's never too late to adopt brain healthy lifestyles and to change those performances to kind of ensure that your future is as best as good as it possibly can be. So aging, what about health? Is that what we're talking about when we're talking about aging? Over a lifetime, things like infection, medical conditions, and chronic diseases actually influence how we age. And we do accrue more conditions as we get older. So is aging just illness? Is it that the accrued effects of illness? Because each time you have an illness, it's certainly from a brain perspective, it has an impact on your brain and how it functions, and also on vulnerability and susceptibility. Someone says they can't see the slides. I can see them.
Yeah,
They're
we can
beside,
see the slides behind you.
yeah, that's
Yeah.
okay. I just saw that popping up. Okay. So yes, and is aging about accrued effects of illness over our lifespan, or actually the increased risk of illness, of injury, of disease that can occur as we get older? Of course, as genetic and congenital conditions aside, and developmental disorders aside, many illnesses and diseases we encounter are related to the choices that we make across our lifespan. So illness is not part of the aging process per se, but it does influence how well we age. And from my perspective, I look at that as saying, right, we have some control. We can look after our bodies. We can take on board risk factors and see if we can mitigate them. As we progress through life, the roles that we play change. And many of these come with cultural and societal expectations around how we are expected to behave and how we are treated. So, for example, we would expect someone who's a judge, a high court judge, to be a much older person. We would expect a soccer player to retire far earlier than someone who's working in an office. And so there are societal and cultural expectations about how we should behave that come with aging, same as they come with, as we talk about, differences and neurodiversity, and masking and trying to fit in with what society expects. That happens really, in a sense, with regard to aging. It can be so, we can assimilate it so much that perhaps we just behave in a way that we are expected to behave, rather than a way that really is true to our core self. So, of course, across the lifespan, we also encounter age-related restrictions, like, the biggest one for me, and I'm not a fan of retirement, because doing nothing is really just not good for aging well. And I'm not implying that everyone who retires does nothing, but to think that to retire and sit back and do nothing is going to be wonderful, well, it will actually reduce your lifespan and make it far less enjoyable than it would be otherwise. But for example, a lot of these age-related restrictions are completely arbitrary. I mean, age 65 as an age for retirement was just plucked out of nowhere by Otto von Bismarck, and we've just stuck to it. And now, we're talking about, well, maybe we'll push it out because we can't afford to pay pensions for people from that age or whatever. But it's got no relationship to actually aging, and it completely ignores the wisdom that people have built across a lifespan. And we were talking about academia earlier, and the ageism that exists there, as well, that really, you're asking people with the most knowledge and experience to retire and stop working and make room sort of for younger people coming in. And it's just very, very mixed up, I think. But it all influences how we age. And of course, you see, that's not universal, because many of these restrictions and expectations, they differ across cultures and across countries. So they're not just, a normal part of aging. They are driven by society and culture. Now, because we're human, we often conform to societal expectations. We're social creatures, and we don't do well in isolation. And, the whole social isolation thing that came up there, nobody does well in isolation. And in fact, it is a big risk factor for developing dementia in later life. So it's, but I think it's just, it kind of came up when the earlier speaker was talking. Social engagement and loneliness, it doesn't mean that you have to have lots of connections. It just means that you have to have sufficient connections of the type that actually satisfies your needs. That could be one person talking to one person once a week, once a month, or it could be talking to multiple people all the time because that's what you need. Again, it's not a one size fits all. And that's a mistake across, I think, a lot of areas in medicine and in healthcare. I question, do we act older than we really are in conforming to society? I mean, a lot of people expect us to slow down. I actually moved house about 4 years ago, and people asked myself and my husband, "Oh, are you downsizing?" And I said, "No, actually, we're taking on a big project. We're upsizing because our kids have grown up and we need a project. We need something to do. We need something to do together." And so we've taken on this project. But the assumption there was that we should be downsizing and making our lives smaller and less challenging, when in fact, to age healthily, what you need is more challenges and more things to do to engage with life. So in expecting people to slow down and creating a society where older people are expected to sit back and not engage, we actually are accelerating the aging process from both a biological and a brain perspective, because the brain needs challenge, it needs engagement, it needs activity, it needs opportunity to contribute to life. We all need purpose and meaning, and that's what makes life worth living. And often that is just taken away from older people out of a sense of well-meaning, but it still is absent. So what is aging then? You know what? It's just all of the above. It's a multifaceted concept. Some factors are beyond our control, factors that are genetic, even the length of our telomeres, when we're born, influence how well we will age. But then there are a lot of factors that are very much within our control. And we all age in different ways. And when I say within our control, there are personal factors that are within our control in terms of choices that we make and things that we do. But there are also factors that are societal and cultural that we can come together at groups and try and effect change in those, because that's really, really important. So basically, yes, multiple factors, different trajectories. I mean, I could talk forever about all the factors that influence how we age, but there's the genetic heritage, DNA, your medical history, your mother's diet when she was pregnant with you, the air quality, and I've mentioned again, society and culture. There's so many factors. And while we acknowledge the multitude of factors that influence how we age, I think it's important to note that not everything that we blame on aging is actually aging. And for one thing, well, first of all, I would say, in the sphere that I spend most of my time is, dementia is not a normal part of aging. The brain can remain relatively healthy. It's disease that causes decline. And that's a really important message to get across. But also, one of the reasons I wrote the book, Beating Brain Fog, was that I felt there was a collection of women of a certain age who were experiencing brain fog due to multiple factors, underlying health conditions, menopause, perimenopause, stress, lack of sleep, all those kind of things in middle age, caring for older persons while also working, while also putting kids through university. And they were catastrophizing that they were getting dementia. And brain fog is reversible, and it has actually different symptoms, but it's very debilitating. And of interest as a female, it disproportionately affects women for lots of reasons. Yes, the effects of stress, burnout, overload, that's what's causing those, not the fact that you're now 63 or 64. Similarly, menopause can influence on that. And polypharmacy is a huge issue. Any medication that acts on your central nervous system has the capacity to change your cognition and your cognitive functioning. And again, just talking, there's an issue being a female in that, most drugs were developed and tested on males. And then there's a surprise when, for example, heart medication doesn't work the same way in a female as it does in a male. And the same applies across neurodiversity, especially when it's acting on, anything to do with your nervous system and your cognition, whether the experience is going to be the same, because we don't specifically test drugs in that way. And then depression, illness, and disease, they can all feel like aging. They can feel like they're making us older. And again, these are things that can be tackled. But again, looking at the slides from the last talk, for neurodiverse people, and for various other groups, some of these things like depression and isolation are more likely. So that increases vulnerability. So on the aging part of it, I wanted to kind of finish off with a positive, because I am a real advocate for positive aging, and I will testify that honestly, life actually is much easier when you get older. To a certain extent, you know who you are, you care less what other people think, and you just. For me, I said this to my husband once, and he found it very depressing. For me, I find it very motivating. I know for sure that I've lived longer than I have left to live. So what's to lose? Just go for it, enjoy life, do what you want to do. And I don't think you feel that freedom when you're younger. You're too concerned with what other people think. But the good news is that older people are happier than younger people and than middle-aged people. There is a slight dip in late life in your 90s, but it never dips to the level of unhappiness that we feel in our 20s. We're also, better at conflict resolution, and if that follows through, it should mean that we have less conflict in our lives. And older people experience less worry, less stress, and less anger. And I do think a lot of that is to do with feeling more comfortable in your own skin and actually knowing who you are. So attitude, I suppose it's the story we expect to live out. It's our perceptions, our beliefs, and that influences our behaviors, and that in turn will influence our outcomes. So far, mainly I have focused on the biological, but now I really want to talk about the psychological in terms of, we're talking about attitude. But actually, what I will argue is that psychological is also physiological and biological, because everything you do, you think, every way that you behave actually has a physiological response in your body. So it's kind of an artificial distinction that we have. And I think it's rather interesting from a medical perspective. People go to a doctor and they're expecting a medical diagnosis, and if they're told that maybe it's stress is as the root cause of it, or something other psychological, they somehow feel, no, I wasn't heard. That's a lesser thing than actually being given a medical diagnosis. But actually it's not. It actually is empowering. And the problem is society having a hierarchy of a biological diagnosis versus a psychological diagnosis, when they're both equally important. Basically, yes, how we age is influenced by how we perceive ourselves and how others perceive us. And that influences our self-perception and our attitude to aging. They're both really, really important when it comes to actual aging. So just to touch on some research very briefly, adults over 50 with a positive perception of aging live on average 7.5 years longer than people with a negative perspective on aging. Like, that's hugely powerful. That what you think about aging influences how long you will actually live. And the researchers from that Yale study showed that the benefit was greater than having a healthy BMI, not smoking, regular exercise, lowering your cholesterol, and lowering your blood pressure. Now, I'm not saying, dump all the other things and have a positive perception of aging, but imagine the benefits if you actually do all those things and then work on a positive perspective of aging. And we really do have to work hard at it, because we live in such an ageist society. I walk in a shop and everything is in the department department store is designed to help me not look like I really look like when I get up out of bed in the morning, you know? It's so ingrained. People going into research, participants in research studies, who have positive are presented with positive stereotypes of older people perform better on memory tests. And kind of conversely, there's another study was done, and for one group, before they went in, just as they were going in to do the test, one of the research assistants reminded them that, look, you know, we know older people's memory is much poorer than younger people, but, you know, don't worry about it, go in ahead. Just that little phrase, the people in that group performed more poorly on memory test than the other group, who were just sent straight in and matched on everything else. So what other people say, what we think, really does influence how we perform. So yeah, aging is ageism is so pervasive, it's very difficult not to assimilate those assumptions. You know, we're trained in ageism from when we're children. We really are, you know, oh, look at that little old lady over there. You know, it's incredible. You know, kids who can't spell or maybe not even fully identify their colors can actually pick out an old person in a picture. So we're really starting very early othering older people in some regard. So the positive message I want to get across is, look, you know, regardless of genetic heritage and life history, look, you know, my own mum had dementia. I'm an ex-smoker, heavy smoker. There's lots of things I've done that impact on, you know, my health in the future and my risk of, say, developing dementia. But I know, and I know from research, that we can still shape our future by how we think and how we behave and the choices that we make today. So I hope that lets you know the importance of attitude. And I'm talking about in that it's all consuming our perceptions, our beliefs. They really do influence our reality, because it influences the information that your brain filters in. And your brain, if you believe X, your brain will filter in anything that supports that. So if you believe that bad things happen to you, your brain will go, look, there's another bad thing, and there's another bad thing. Good things happen to optimists because they instruct their brain, good things happen to me, and your brain will go, oh, look, there's another good thing, there's another good thing, and sort of pays less, doesn't even filter in some of the bad things. The thing is, from attitude to ageism, that, you know, it's not a big leap, because expectations then can turn into assumptions. And ageism, of course, can impact on people of any age. But given the nature of this conference, I'm just focusing on ageism in later life. It is, as you mentioned at the start, Susan, the most common form of prejudice, and it is more tolerated than racism and sexism. And you know what? I left Twitter when what's-his-face took it over. But at the time when you could still have conversations on it, you know, I used to make a point of calling out ageism where I saw it. And I have never encountered so much refusal to accept that what they were saying or doing or implying was ageist. And I know I wouldn't encounter that when I call out something else. You know, you call out sexism and people go, oh God, you know what? Oh, I should have thought of that. But there's a real resistance to admitting to it. The interesting thing about it is that it is the only ism that targets our future selves. So we are setting up a society that will be unpleasant and ageist for us when we get there. And I think that's the problem with othering that we do, because we talk about older people as if they are someone else. But it's us. Well, it's me now. I'm in that category. But even when I talk about the oldest old, that hopefully will be me someday if I don't pass away before I hit those bigger numbers. So ageism, yeah, I mean it's the stereotyping and prejudice and discrimination, which is the big issue based on age. And it impacts on our health, that was mentioned early, but also on our healthcare and the treatment that we receive. The biggest proponents of ageism are younger people, and I don't blame them. I was probably ageist when I was younger also. But also, really quite scarily, our governments, healthcare systems, and healthcare professionals. Where does ageism live? Everywhere, basically, if you look at it, it's very common in the workplace, in healthcare. It's huge in the media. I don't have time to even just go into it, but you'll know it yourself. The way people are reported, but also the way people are portrayed in movies. I read books, and the character is being described to me, and I'm going, oh, I'm imagining this really old, frail woman, and then I look and I go, hold on, I'm older than her. Do you know that it's just it's not thought about, that people are very conscious now, in a very woke way, about what's not appropriate to say or include in books. But I can still see ageism throughout books that are written in the here and now. That kind of message hasn't got there. Yeah, a technology, language, policy, you can find it anywhere. The thing with ageism in healthcare is that it leads to under-treatment, under-investigation, and older people with treatable conditions are under-prioritized. One study showed that only 30% of people over 50, now I think 50 is really, really young, but only 30% of people over 50 with depressive symptoms received the medical therapy that their younger counterparts would have received. And that, what the research showed was they were less likely to receive treatment, the same treatment as a younger person, even when the data shows that that treatment would be effective. Now, to my mind, that is just writing off. You're not worth treating. I mean, and why would you not prescribe? If a 20-year-old comes in and, they have symptoms and they tick all the boxes for a prescription, you give a prescription. Why would you not do the same for a 55-year-old? And when does it stop? When is that kind of cut off in people's minds? I think that's really very scary. And then it's not just the medical professionals. So this particular study I'm going to refer to now just surveyed regular people, not in the medical profession, asking them, I suppose it was a dilemma question, who should have heart surgery? So there's an old man and a young man, both on the same waiting list. They've both got equal need for a bypass. And 63% of people will say the older man should get that bypass. On what they know nothing else about the individuals other than their age. So that's pure discrimination. If you swapped age for a Black person or a Caucasian person, or for a woman or for a man, people would be horrified. And yet we assimilate it. We all we think it's okay. Sure, the older person has lived their life. Well, do you know what? I live my life, but I'm still damn entitled to live the rest of it. I don't need more respect. I don't need more treatment. I just need equal treatment. That's it. Full stop. And then there's the just aging trap. My son is a GP, and I get the just aging. When I say, oh, Darren, I probably shouldn't have said his name, but I say, I don't have that. Oh, Mum, that's just your age. And you kind of go, really? Really? Did I raise you like that? But I didn't. But the medical system within which he works, that's where it comes from. And that's not good enough to dismiss older people and not diagnose them and not treat them. And of course, all of what I'm talking about is compounded exclusion when you add neurodiversity to age. So yeah, it's very much inherent in our medical system. And I've spoken to people about locked wards in hospitals. And I've spoken to people from all walks of life and said, you know that there's some hospital wards where, so my own mum would have experienced this. She had delirium and she was inclined to want to wander and leave the ward. So she was put in what they call a locked ward. And that's not a ward, that's a prison. If you deny anyone the right to leave a room, that is imprisonment under any shape, make, or form. But the most answers I would get to that is, oh, but it's for their own protection. But do you lock a ward for a 40-year-old who's had hip replacement and wants to go out, walking around a ward? You don't. It's ageism. What's wrong is you don't have enough staff to ensure that they are safe if they want to go walking. That's a whole other issue, and the solution is not correct. So yes, and then what I want to say is not all older people are the same. That's the big kind of thing with ageism, is everybody's lumped in together. Older people, in fact, are more complex and more varied than their younger counterparts, simply by the virtue of they've had longer years, more experiences, and there's huge variation in older people, even in older people who are of the same age. So I think in Ireland, we're very good at respecting our elders. A lot of us are brought up to respect our elders, but often what we do is very well-meaning, but it is still othering. It's still kind of got this sense that older people are frail, they're dependent, and we refer to the elderly, which to me is no different than referring to the gays or the blacks or once you put the in front of it, it creates a whole other group. And yes, and the other speaker touched on this earlier. Self-directed ageism is the most dangerous form of ageism, really the one that we aim on ourselves. We absorb it and then we, actually behave in ways that can be detrimental to ourselves. So the good news is that ageism isn't inevitable, I beg your pardon, it is learned, which means it can be unlearned. But if we want to do that, if we want to bring about change, we really need to take action. We can't just sit back and wait for it to happen. We have to take action. So just a little suggestion on that is notice it, name it, nudge it, something that we can all do. Really. And when I say notice it, I think that's really important because so much of it we accept. Like that, people that I know just accepted that, oh no, locking a ward, that's good. That's just the way it is. That's just the way it's done without actually questioning. So I think if you are notice yourself, notice the thoughts that you have, whether you're limiting your own behaviors, whether you're saying things that are ageist, where is it occurring? Notice it in others. And one thing that I would say to take away is to see the person, not the age. I think that's really, really important. And I think that works both ways. I really do. I think older people need to see the person, not the age. And I am a huge advocate for intergenerational friendship. I'm not talking about forced contact, but the problem is if we only have friends the same age as us, your social circle will diminish as you get older and you will be left isolated because your friends are going to die off and you might be the one left longer. So and the research shows that all groups benefit from that intergenerational contact. Yeah, just name it. It doesn't mean confrontation. It can be very gentle and you can just do it in a sort of a sensitive way. God, that sounds a little bit like age-based assumption. Would it be? Is there any other reasons for that? Now, I'm terrible. I'll come straight out with it, which is why I'll kind of get the feedback. But I know not everybody is sort of as outspoken as I am. But then by nudge it, what I mean is try to replace the stereotype with something that is more true. And I think that's important. I try to do that. I've never shied away from my age, and I kind of look at things and it talks about people in their 60s. I'm 63. I'm going to be 64 next month. This to me is what 64 looks like, not what I see myself portrayed as. And I think we can all do that in different ways. And I'm not talking about just by looks. Yes, I dye my hair and I, have makeup on, but it's not about that. It's about actually the rest of my life. I'm either giving talks or else I'm working on that project that we said I moved on. I have 5 acres of lawns to cut. I use a strimmer, I use a chainsaw. That's what I do at this age. And I think we can really help nudge stereotypes by exposing people who don't fit that stereotype. I think in healthcare, I would suggest that, that doctors and healthcare providers be curious. Be curious what's actually might be wrong with the individual or might be amiss or might be causing their symptoms rather than just dismissing it as age. With that, then we might actually get to the root of maybe what ails us or why we've gone to the doctor. And then with regards to other things that happen as we age or with neurodiversity is we need accommodation, clarity, a quiet place, people to have choice, time. I mean, I remember when my mum went on to develop dementia and she would have to go in for blood tests. And I remember asking, could I go in with her? Because she didn't know where she was. No, we don't like someone to go in with her. And I said, well, my mum doesn't know what's really happening and she'd be nervous. I've brought her from, care home in here and she says, where am I going? What am I going to have done? And, she was going to have her blood taken, etc. But they didn't want to let me in. Now I fought and I got in, but I don't know that there are other people who are able to give that fight. Yes, then with regard to the social cultural action, we need to call out the media. We need to ask for different images of older people. We need to ask them to record something other than their age. And I also think we need to stop flattening aging. Do you know what I mean? We're ignoring the diversity of older people. And also a biggie for me is to stop blaming older people for things like housing crisis and lack of beds in hospitals. Older people are not bed blockers. What's the problem is generally is they're sent into an acute hospital and then there is nowhere for them to go for step down care. And that's not their problem. That's not their fault. That's the system. And likewise, the housing problem, if older people have worked hard to have a home, it's not right to say you should leave that home now and give it to somebody else. It's just equal treatment, really, for all. And I think that is, yes, down to my summary. The key takeaway is, aging is complex. Attitude shapes our experience and how we age. Ageism absolutely harms our health and our mortality. And action changes the outcomes if we take action. Thanks very much for listening. I hope it makes sense to you.
Wonderful. And nobody wants to stop your flow because it's so exciting to hear someone, thanks so much. You've really inspired people with so many individual things that they can take responsibility for to improve their aging. And also I loved, there were many things, but the social piece that we can all be strong on. I loved you saying it's a discrimination against our future self. So something that we all need to take action on. Now, I might have time to take a question. I see one, there's more of a comment, is somebody has made a comment about, they were asking you for, is there a workbook or workshops that are based on beating brain fog? Because they were hoping that could be supported.
Well, I have a book, but and again, I've been very strong advocate that all my books are available in audiobook because I know not everybody can sit down and read and take in an entire book. No workshops, but my book does have very personal questionnaires so you can identify what aspects of your cognition are being impacted so that you can go to your doctor or your GP and say, rather than saying, oh, I'm fuzzy or I'm foggy, saying, look, my executive function seems to be impacted. It's changed because really, I suppose, kind of going back, and one of the reasons I wrote that particular book is because so many of us were being gaslit, particularly women, and particularly women going through perimenopause and menopause who really thought they're going insane. And I mean, I've had that myself, going to a doctor and being told at one point, after blood tests, look, I wish all my patients were as healthy as you are now. Go home and enjoy the rest of your life. And I went home to my husband and went, I think I'm going insane. Why would I go to a doctor complaining of X, Y, Z if I'm not experiencing it? I remember being absolutely devastated by that, and I think that's quite a common experience for females. And I can only imagine what it must be like, for people with autism. I have a husband and son who are dyslexic, and on some attention deficit issues, and I know how challenging life has been for them. So consultants don't like to hear your own knowledge and insights info.
Yeah, you fired up the chat, so there's lots of there for us to follow up. We've had one question there, and it's saying, what are the most effective interventions for us tackling the stigma, the social stigma, towards aging? What do you think we should do,
I
apart from
wish
revolution?
yeah, I wish I knew. I really do wish I knew. I do, though, think if we say nothing, we're not going to affect change. I think that we can learn from what has happened, sort of in Me Too movements, etc. I think we should speak out about our ageism. I've certainly done that, in terms of, mistreatment of older adults, in people with dementia in hospitals, and the treatment is quite frightening, to be perfectly honest. People being chemically restrained because staff don't want them walking around. People being put in incontinence wear who are perfectly continent because they haven't got staff to walk them to the bathroom. And that's what's ahead of us, folks, if we don't do something about it. I guess we just need to have, conversations, and we need to call out, things like radio are amazing. If you hear something on radio that is somewhat ageist, send in a message. The host will love to read it out. It doesn't have to be these big. I'm a firm believer that big change happens when lots of people do little things. And that's all we have to do. It's just a little thing. And that could be a message to a radio host. It could be a small letter to the newspaper, anything. But we need to kind of all sort of start to do it and take a bit of responsibility.
Well, thank you. I mean, this could go on for an entire day. I think you've got everybody fired up, a lot of people identifying, a lot of people sharing experience. But I think I hate to say it, but it's time for me to hand back to Charlotte. We're very inspired.
We have a panel. We have a panel discussion now.
Exactly. So you can take it forward now. I'll hand back to Charlotte.
Okay. I just